morning, how are you?
Doing fine, how are you?
I'm doing well, thank you. I'm Laura. I'll be your nurse today. How are you feeling?
Feeling okay.
Good.
Stress.
I just. Do you want to tell me about it now or after the
I mean
assessment?
later, probably.
Maybe after later.
I
Okay,
know.
well, maybe we can talk
Yeah.
about that in a minute or so. I just need to listen to your heart and lungs and see how your joints move. Is this a good time?
Yes.
Good time?
Yes.
Okay, perfect. So I'm just going to start with palpating your head. I don't feel any twitches. If I do something that maybe is uncomfortable or painful, go ahead and let me know and we'll stop, okay? I'm going to be moving your joints, and so sometimes if you get a little uncomfortable, I want to know about it. I don't want you to just suffer. Can you open your mouth and close it? Perfect. One more time. Perfect. Good. Can you smile for me? Good. And frown? Can you raise your eyebrows? Yeah, that's good. Doing it, I'm going to shine the light in your eyes, and if you just look straight ahead, that'd be perfect. Good, and one more time. Side, perfect. I'm just going to put my hand here and shine the light one more time. Good job. All right, can you follow the pen with your lights, with your eyes only, with your lights only?
I know what you meant.
Good. And then we're going to go from side to side. Perfect. Now this is uncomfortable part. Can you follow the pen with your light? Thank you. I really wanted to say that. Thank you. That was good. I'll check your ears. No sores, no open areas. Nothing on the other side. Good. Nose. Can you cover one nostril and take a deep breath? And then do the same on the other side. Good job. Can you open your mouth, please, for me? Okay. And then can you stick your tongue out? And can you say Good. And can you move your tongue from side to side? Good. And can you swallow? Good job. Well done. All right. Can you push against me, please? Nice. And then I'm just going to palpate your shoulder. Okay. Any pain, any tenderness? Good. Same thing on the side too. Any pain, any tenderness? No. Can you bring your arms up in front of you and to the side and then over your head and then back down in front of you and turn your palms up and back down and hold it there for me, please. And let me push. And let me push. And let me push. Yeah, thank you. And don't let me push. Don't let me push. And don't let me
She's
push.
very strong.
Good. Can you put your hands in front of you one more time? Spread your fingers, hold them. Talk, don't let me push. Don't let me push. All right. Good job. Okay. Put your hands down. Close your eyes for a second.
She did keep capillaries refocused.
All right. Close your eyes for a second. Let me know when you feel sharp or dull.
Sure.
Good job. Well done. Okay, I just want to palpate your muscles. Any tenderness, any pain?
Looking
The temperature is consistent, color is consistent. There are no open areas. I'm going to check your skin temperature. I'll just pinch you a little bit. Looks good as well. I don't see any open areas. I'm going to start listening to your heart and lungs. And so what I will do first is I'm going to listen to your lungs, and I'll ask you to take a deep breath in and out, and do that every time I touch your chest with my stethoscope. And then I'll proceed to listening to your heart, and then I'll listen to your lungs in the back. So a little bit of breathing. If you get tired from taking all these deep breaths at the same time for a long time, you just let me know and we'll take a break, all right? So just start actually with checking your pulse here, and you can breathe normally for now. I feel your pulse and it feels really nice and strong. Now I'm going to ask you to hold your breath. Good job, and breathe again. We'll do the same on the other side. Good. And now hold your breath. And breathe normally. Excellent. Got your breath, cut your breath, doing okay? All right, I'm going to start listening to your lungs. So, listening for tracheal sounds. Good. And then I'm just going to slide my stethoscope down here. So take deep breaths in and out. Good. One more time. Lung sounds are clear so far. I'll listen to a couple of more spots. Putting it over your shirt just so the rest can see where I would place it. And the same on the other side. Good. How are you doing? Breathing
Fine,
okay?
yeah.
Could you give yourself a big hug? And listen to your lung sounds here. Oh. Funny place to listen. I'm staying right under your armpit right here. Not going too far down. Let's put your arm just a little bit higher here. Yeah. Good job. Right, well done. We'll give you a little break and we'll listen to your heart now. So if you don't mind lying down for me, please. I will go ahead and bring you up just a little bit. And then look, I'm gonna let you decide how comfortable you are with taking off your shirt or lifting your shirt, or you know, you are the movie star. All right, thank you so much. So I'm just gonna come over here. Sorry. So I'm gonna just palpate your chest first. Sorry if my hands are cold. I'm just looking for your clavicle. And your ribs, the first rib is going to be tucked in underneath. And then, let's see, kind of, these two are close together. So, I'm not sure if there's a space there. That's curious. You're fine, don't worry.
I was like, oh, what? I was like, dang. Assessing, I was like, oh, call my doctor.
So listening to the aortic valve, and you can breathe normally. I'm just listening. Okay, and listen to pulmonic valve. I hear strong, regular heartbeat. I'm going to find the sternum, find the sternal border. Third is Erb's point. And I can clearly hear S1 and S2. Coming down to tricuspid valve. Making sure that I don't let go of the spot as I'm coming down. All right, have my mid-clavicle, fifth intercostal space right here. of midclavicular line. So I'm gonna grab my stethoscope for me and just put it under your shirt if you don't mind, and I'll position it a little bit better once you are there. All right, thank you. So I'm just gonna listen to your mitral valve, and then I'm also going to count apical pulse for a full minute starting now. Okay, 65, your heart rate is strong and regular, so stay there for a second. We're going to put the gloves back on. It's hard to stay still for so long. All right, so now I'm going to listen to your bowel tones. I'm going to look at your abdomen. Is that okay if I lift your shirt just a little bit? Oh, thank you.
I know, this is nursing, nursing lipids right here. No time exercise, yeah.
Okay, so I'm just observing first. I'm looking for any scars, any striations, any bruising, any injection marks, like if my patient had diabetes, or areas of lipohypertrophy, any abnormalities at all. Noticing the shape of the abdomen, which is really hard to do right now because kid is not lying down flat, so I can't really fully assess that. And then I'm gonna listen to his bowel tones, lightly placing my stethoscope in 4 quadrants, listening for the bowel tones. Once I hear the gurgle, I can move on to the next area. Good. 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 Any pain or tenderness in your abdomen?
It's okay. No.
No pain.
No
No
pain,
pain.
yeah.
Okay, good. I'm just gonna palpate it a little bit. If you feel any pain, let me know. Feels okay so far? All right. Systematically go around the abdomen. No pain, no tenderness. Sometimes it's helpful if you have your patient bend their knees. So can you bend your knee? Both of them. It relaxes the abdominal muscle a little bit more, makes the palpation a little bit easier, especially if your patient can't quite relax. All right, good. No pain, no tenderness. Okay, so abdomen is non-tender. Go ahead and put your legs down one more time for me. Perfect. So I'm going to move on, and now, since I've got him lying down, I'm going to do everything that I can do while he's lying down. I'm gonna put my hand on your hip and just kind of move your leg a little bit. I want to assess this hip joint. Let me know if there is any pain or tenderness. I'm assessing range of motion, and I'm also feeling for any crepitus, any rigidity, any tenderness. If he had any problems, I would feel the joint movements are restricted, or he would grimace. Might be something. I don't feel any of that. Joint movements are smooth. And it doesn't seem like it's causing any pain. Good. I'm gonna assess the knees once you are sitting up. Palpate the muscles. This one is moving more than the other one. Any injuries to your knees? No? Any injuries to your knees in the past? No?
No, just foot.
Just the foot?
Yeah.
Okay. It has a little more.
So this is better? This is moving better, you said?
They're moving equally well. Just the
However.
patella is just a little bit, has a little bit more movement here. You'll get a little thing. Okay, so I'm gonna have you bring one leg up, and doesn't matter which one, just do one at a time. Okay, and put it back down and bring it out. Okay, and then out to the side and back in, and the same with the other one. Flex your knee, bend your knee, and then, yeah, good. And then I'm gonna ask you to bend your knee one more time and bring it over your left leg, and then out this way. Any pain, any tenderness? Okay, good. Can you do the same with the other? Good work. All right, can I take your socks off?
Okay.
You're such a willing patient. Thank you. All right, good. And so we palpate and we assess for temperature. And then if you had a patient who had just a gown, you can kind of look and see at the hair distribution, which is, and check the temperature and the color, and those are really important. All right, so I have dorsalis pedis on both sides. Oh, yes, you have really good pulses. It makes it easy. Otherwise, I'd be standing here for a few minutes. All right. Oh, I spoke too soon. No, good pulses. Okay, capillary refill and capillary refill. And then close your eyes. Tell me when you feel me touch, and if it's sharp or lighter.
Sure.
Sharp. Sorry, I kind of scratched you a little bit. Apologies. Okay, good job. Let's see. Can you push against me? Good. Don't let me push. Push against me again. Good job. All right, I'll help you sit up now if you don't mind. So change my. And I'm gonna. I need to listen to your lungs on the back. So I wonder if you don't mind just maybe turning a little bit one way or the other. So we could, yeah, that'd be perfect. All right, so get a back rub at the same time.
I know, I'm getting massage.
Nice, right? So spine, and then scapula, and you can have your patient move their arm, and so you can palpate better. So here's the space between the scapula and the spine, and that's where I'm going to listen, and I'm going to listen on skin, but because I want you to see where it is, I'm just going to place my stethoscope. You can breathe normally. I will just demonstrate placement. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And we already listened to the sides. So go ahead and put your socks on and sit up for me. I'm the edge of the bed. finish up my musculoskeletal assessment. I can see that you have good trunk control, and we've already assessed your hands. Push against me. Good. Push against me. Good. And then push against me. Good. And push against me. Good. And then push against me. Okay. And push against me. Okay. Can you tell me where we are? Where you are today?
Bayside College. Do you want the specific one? Is it B309? 409?
What is the date?
It's Friday, May 20. This is outdoors oriented. 13th? No, I can do that. Follow orientation. Friday,
You're right, today's
May 13th. Oh yeah, see, I'm cheating. No, that's not good.
May
13th, yeah.
Friday the 13th.
But I didn't know the 13th though. Let's just say I didn't know the 13th.
So our vision is alert and oriented times 1.
Times 2.
Times 2. Okay, we'll negotiate that. Okay. All right, good job. If you don't mind standing up for me for just a second, that would be perfect. So if you can turn towards the door, please, and then put your feet together and close your eyes. All right, and you can open your eyes now. And can you stand on one foot? Your eyes are open, right?
Yeah.
Okay. And can do the same on the other side, please. Oh, okay, good. And can you walk towards the door and then come back towards me? Please, thank you. And then you can come back.
Okay.
Okay. So I am assessing the posture, the gait. I am looking. Can you bend down all the way? All the way. Down, down, down. And then come back up. No, do it again, but come back slowly.
Okay.
Okay. All right. Good job. That is about it.